G'day, my name's Ian Campbell from Palliative Care Australia. Welcome to Thursdays at 3, a series of conversations with people living and working at the end of life. Our very special guest this afternoon is Professor Samar Aoun, who is the West Australian of the Year for 2023 and now in line to be the Australian of the Year for 2023. Congratulations, Samar. How does it feel?
Thank you, Ian. It's such a great honor. I'm so thrilled, and I'm really even more thrilled that I'm just really the voice for palliative care. I could amplify that more for the needs of the sector, including, of course, compassionate communities. That's part of palliative care.
Samar, your latest award is just one of many in a really distinguished career. Let's go through your bio in a little bit more detail. You're the head of palliative care research at the Perron Institute at the University of Western Australia. You're an adjunct professor at La Trobe University. You co-founded the Southwest WA Compassionate Communities Network in 2018, and you lead the Compassionate Connectors program. You're also very involved with motor neurone disease. You're the chair of the MND Association in Western Australia. You're a director on the board of MND Australia, and you're a member of the scientific committee of MND Research Australia. And to cap it off, you're a director on the board of Palliative Care Western Australia. Internationally, you're all over the place as well. You're a busy lady. You're a lady in demand with the European Association of Palliative Care and the Public Health Palliative Care International Network. A busy lady, as I say, Samar. What do you want us to know about palliative care? It remains a mystery for many people. What do you want people to know about palliative care?
You're quite right. I mean, I did say for a while that still the community is confused about what palliative care is about. They just think it's only end-of-life care. And therefore, they miss out so much on having that quality of life until death arrives, or that family support, or that spiritual, psychosocial support, and later on bereavement support. But again, this is ad hoc for palliative care services. I mean, they're doing a fantastic job with symptom management and the clinical care, and it's not quite consistent. All the other holistic care that palliative care is about. And hence why my interest as a non-clinician in the compassionate communities approach to care, and what led me to actually trial this Compassionate Communities Connectors program for end-of-life care in conjunction with health services. The community can't do it alone, and the health services can't do it alone. It's a partnership that needs to go to improve quality of care, quality of life, and quality of death. So my aim, and the aim of a lot in this field, is to have palliative care accessible to everyone and everywhere. And I guess my work with motor neuron disease, it's what led me more to do more work in this field. Sorry.
So you're a lady in demand. Everyone wants to talk to you.
I should have put it on silent. Sorry.
You're right. No worries.
So motor neuron disease, which is an absolute death sentence from the start. Unfortunately, there's still no cure, or treatment. But a lot of work is being done in this space, and we're hoping, for something to happen in the near future. But I just noticed, when I started research in the palliative care field, that they are really such underserved population, along with other neurodegenerative disease, and now, of course, dementia as well. And I felt they are missing out on so much of good quality of life until death comes. But again, you get palliative care health professionals saying, well, we can't cope with every life-limiting illness. And again, these are the specialist palliative care services. And hence my whole then focus became on the palliative approach to care. It's about how all generalist health professionals can apply the palliative approach to care, and how the community can do that as well. And hence, until we have the community as an equal partner in delivering this support, we're not going to move any further, or the community is going to understand more what palliative care is about.
Samar, I'm keen to pick up a few of those points, especially your community-based approach to palliative care and your interest in MND. But at the heart of what you've just said is receiving palliative care much sooner than perhaps many people receive palliative care at the moment. It's not just that final part of life. That seems to be at the heart of what you were just talking about, that people should get access to palliative care much, much sooner than perhaps they do now.
Yeah, absolutely. And again, from the diagnosis stage, it's important so that they are connected with the whole palliative approach to care. And every health professional, every single person in the community needs to know how to support them when they get this bad diagnosis. Again, through, that's part of the research I've done. How do you deliver bad diagnosis and how do you receive it? And again, that's an issue for motor neuron disease because 40% of a national survey said they didn't have it in an empathy and a compassionate way, when they knew that there's nothing else for them. But the ones who did were able to cope better with their journey, and it's actually that journey that matters. And again, having talked to a lot of MND, patients and families, it's not death that's scary for them. It's that journey that's going to get them there. It's all that disability, it's all that social rejection, the social isolation, the carer burden that they experience, anxiety, depression, all that. And this is where, we can all help in that journey, so that when death comes, they experience a good death after they've experienced, a good life, So this is where sort of I'm hoping to get this message across in the next 12 months.
Where does your passion come from, Samar? How did you go down this path? For many people in the palliative care sector, it comes from personal experience, from family experience. How did you come to be here?
Ian, because I'm a researcher, I've always focused on delivering the research outcomes and making sure they go into translation and practice. And I never really reflected on my personal journey. But ever since the state award, people ask me this. And so I've reflected more. And I guess it's like I've got three different reasons why, or led me probably consciously or unconsciously to take up, not just palliative care, but community service in general, because this is where I mix the two between my professional and voluntary work. My grandfather, who's Dr. George Aoun, he served the community in Lebanon, in northern Lebanon, again, in a selfless way, never really asked for remuneration. And he was a doctor, and there were few of them at the time. We're talking about early 1900. So when he died, the Lebanese Republic acknowledged his services with a medal, which basically that's the one I've offered to the museum in Canberra, because each finalist had to offer an object so that it's exhibited in the museum, and then it'll do the tour. And I thought, what a marvelous opportunity. It's just hanging, on my display, but to have, everyone see it now after so many years, that's fantastic. So that legacy in community service is part that I grew up with. And it was great. But then off comes the war in Lebanon. And I was an adolescent at the time, but, it just marked my life so much because we had no choice in how we wanted to die. Well, we had actually four choices, either through indiscriminate shelling or car bombs or sniper fire. And if you happen to step into an area where it's not of your religious affiliation, well, that's your fate sealed anyway. Mm-hmm. So we faced our mortality every minute, of the day. We just didn't have a normal life, a normal death, couldn't think of anything apart from surviving. And then, of course, fast forward, we came to Australia, which is fantastic, in 1992 after a stint in the UK, where, I did my PhD and my kids were born there. So again, I was asked to join a palliative care team coming from a public health background. And that was great. I mean, as you know, there is this international movement of public health palliative care, who at the time I didn't know it existed. So when I was asked to be part of, a palliative care team, and I loved working, with them and carried on, and started work in particular in bereavement support. And in the midst of all that, well, really at the start of all that work, my father died in 2012. And I got the message really like a day before Australia Day. I still remember this, but I had a meeting at work with some health professionals. So I rang to say, look, sorry, I can't come. Told the secretary to let the participants. That's the reason I really need to book my flight, because it's got to be done within 3 days. The whole burial thing in our sort of customs. So anyway, I booked my flight and everything, and I went back to the meeting that was still running. Obviously, really distressed. Not one of the health professionals who were in that room asked me how I felt.
Really?
Nothing. They just carried on with the meeting as if I'm okay.
They were scared to ask, were they? Is that the
Yes.
assumption you've made?
This really has left me with, okay, we need to do better. I needed support. I mean, just a nice word at the time, not more than this, but nothing. And they were all health professionals. And then I was off on the plane on Australia Day. And the contrast of having my community, when I got there, support me so well, looking after all the funeral, business. I didn't have to deal with that. I felt I was carried on a cloud the whole week I was there. We had 3 days of mourning in the church hall, and everybody who knew us came from all over Lebanon and just sat with us, and we chatted. I just resolved my grief in those 3 days because the community did such a wonderful job in supporting me and supporting my family. And hence, when I came back and I thought we really need to do it better, what I've experienced is not great, back when I was here in Australia. And this is then when I started looking and I heard about compassionate communities. And I thought, wow, this is what I had back home, back in Lebanon, of course, I call it home as well as Australia. That kind of, in a way, fast-tracked the work that, I wanted to do in that space.
Yeah. I get goosebumps hearing you share that story and where it has led in this sort of compassionate communities network model that you've been a pioneer in. And that's really at the heart, that's really the infrastructure for this community-based approach to palliative care that you advocate for. Tell us a bit more about the Compassionate Communities Network, what it is, what it does, what you hope it does.
Well, everybody needs to have, start thinking and talking in a compassionate way. You don't need to have as such a network, but it's good to start having those conversations in the community. But for us, we just needed a committee to start organizing death festivals, dying to know days, advanced care planning workshops. So we got together as a network to start this education and awareness. And our main goal was that everyone in the community needs to know what to do when someone is caring, dying, or grieving. It's everyone's responsibility and it's everyone's business. But people need, in a way, permission to help. We've got so many assets in our communities, and all communities have got that they would love to help, but they feel that they are imposing. There's privacy, confidentiality. And on the other side of it, you have people in the community, and there's a lot of them. They've lost the skill to accept help.
Yes.
That is the problem. And this is what we're trying to teach people. It is okay to accept help, because if you don't do this, you're not doing a favor for your community to skill them on how to actually provide help. I mean, you'll benefit, of course, but it's not just about you. It's about how you're going to contribute to your community getting better death literacy and grief literacy in a way they need people to practice on. And then what goes around comes around. This is how it works in the community. So we needed to work on both basically groups. Please accept the help, because if you don't do, you are shutting around you all the social networks, and you'll become socially disconnected. And this is what we proved in the Connectors program, is that when the Connectors, who are wonderful volunteers with plenty of lived experience, when they started going to people's home and offering that social and practical support and seeing who in their inner circles can help them, and if they didn't have inner circles, outer circles, or the community in general. And we managed to double the amount of networks around these families that would be sustainable, because they made friends. This is part now of who they know, part who they can ask for help. And we had 50% of the people referred to us who are home alone, not because they didn't have families, but they are disconnected. Either their kids are overseas or in another place in Australia. So it was really very rewarding to just get this research evidence, because we wanted to prove that it's not just a lovey-dovey approach. I mean, it makes sense because social relationships are really important. And there are a lot of big trials showing that people who have good social relationships, they have better health, they are happier in life, they live longer. And the opposite is true for those who don't have good social relationships. And other studies showed that people with social relationships, good ones, there is an impact of this on reducing their mortality more than if they cease smoking or reduce their alcohol consumption or reduce their weight. So that powerful thing. But what we wanted to know from the Connector program, are we going to increase social connectedness in a way that all the other trials done, will work for us? So we know now that with increasing social connectedness, it will follow that the health of the community is going to get better in terms of mental and physical health.
What if someone listening to this wants to make their community a compassionate community, wants to be one of those connectors, perhaps? What would your advice be? How does someone start this process in their local community?
Yes, and I get asked this a lot, and I'm really hoping to help as many people as possible and have more people do that work moving forward, obviously more like sort of train the trainer. So what I'm advising people for the near future now, we run connector training programs. And it's very practical. It's one day. So the connectors are part of this training program. They come and explain what it's like for them to work with families in these situations. So once we have sort of more people with that knowledge, they can start and in their own community started bringing in more connectors and, telling people, look, we have this service now, and telling the health service we have this service, because it's the health service who's going to refer those patients originally. But then it doesn't mean that the community can't do referrals, within them. I mean, it doesn't have to be somebody who is already registered with the health service. Primary care referrals are going to be key because what we have noticed is that, and the connectors have said that, it's better if we start upstream, because we did get families referred to the program who were too much towards the end, not because palliative care services referred late to the connector program, because they were referred late to the palliative care service. So by the time we knew about them, they were really too exhausted to actually think about how we're going to get more community engagement around us. So this is why we partnered again with the WA Country Health Service, but with the chronic disease team. So people who have got terminal illnesses or chronic disease, and then, that's upstream. And that's worked better because we did have, at least 12 months to work with, some of these families and prepare them well for the journey.
I was talking to a mum recently, Samar, about her paediatric palliative care journey with her daughter, who sadly passed away earlier this year. And I asked her, what was the best thing that somebody did for you during your palliative care experience? And it was mow the lawn. Somebody came and mowed her lawn. She was feeling the pressure of the lawn growing, the grass growing, the judgment of the neighbourhood. And it was someone who simply came and mowed their lawn. And it sounds like the Compassionate Communities Network takes care of big and small. They mow the lawn, but can do so much more. It's a wide scope of work.
Yeah, and there's the little things that matter, and that matter to these people.
Yeah.
Because when you do those little things, you showing people you love them. You are sharing in maintaining their dignity. They matter to you. So it doesn't have to be big things. And that's absolutely what came across the Connector program. Again, mowing the lawn, cooking a meal, putting the washing up on the liner, taking the kids to school. You know, and when we looked at all the domains of help, you know, like transport, you know, taking to people to medical appointments, all that stuff, 80% of the needs were social. So the connectors in general, they, you know, the stories, you know, of course, I connected with them on a fortnightly Zoom meeting so that, you know, I can hear what's happening in those families. And most of the time they tell them, we don't need help. We just want people to come and talk to us and have a cuppa with us.
Yeah.
That's it.
I'll put some more information about compassionate communities with the video so that people can follow the links and find out some more and perhaps bring this to their own community. Samar, I'm keen to pick up on your migrant story. It's such a part of what we celebrate on Australia Day, Australia's multicultural heritage. You came to Australia in 1992 and you touched on it earlier in a way, I guess, the influence that your younger years in Lebanon had on you and perhaps your approach to death and dying, given that your mortality was a part of every single day. What's the backstory? How did you get to Australia? Was it as simple as fleeing war that you pointed to before?
Yes, I suppose so. By the time my husband and I did our you know, studies in the UK and had the kids, it was still not a safe country to go back to and raise those kids, because both my husband and I, we were traumatized, you know, having lived there through our adolescence and early years, and we didn't want our kids to, you know, relive, or us reliving with them, a sad cause. So my husband had relatives in Australia who they all visited us in London, and they kept saying, you know, please come to Australia, you know, it's a great place to live. And we did, and it's a great place to live, and it's fantastic. We're so lucky that we have heard their advice.
What can you share with us about Lebanon that perhaps we might not know? So much of what we know about Lebanon comes from the news, and it's not always good news. But what would you like to share with us about Lebanon, your birth country? What do we want to know about Lebanon?
Look, it's a beautiful country. I mean, even friends who visited just fall in love with the beautiful nature, with the beautiful people who are there, you know, all that warm culture, that community spirit. But, you know, it's just, unfortunately, it hasn't been shining through with all the, you know, the war we have been through and all the religion divide. I mean, it's all political. It's not about religion, you know. I mean, it's and this is why, you know, we you know, as growing up in this country, you couldn't really adopt a cause and feel passionate about it because it was all over the place. You know, everyone was fighting everyone.
Yes.
So you couldn't say like, oh, you know, you're going to get, you know, this line and this is going to get us to a safe place. And then things tips over, you know, it's very confusing for Lebanese people to actually have a sense of patriotism when we don't have leaders who have got that. And unfortunately, you know, these leaders have been there for such a long time. And it runs in families. So, yeah, all I can say that we were lucky that we left, but we have gone there nearly every year when things were okay. Because, you know, again, you can't really, these are our roots and what made us who we were, where we are now. And we help whatever we can, but there is no light at the end of the tunnel still, unfortunately, and that makes me very, very sad.
Yeah, me too. Is there anything we can learn about death and dying from Lebanese culture, from Arabic culture, that we can bring here to Australia?
Well, that's it, you know, that there are compassionate communities. So that's how things were, you know, in those cultures. And there are cultures, not just, you know, from my culture who do it well, like the Irish do it well, the Aboriginal people do it well, the Maoris, you know. So I guess it's quite interesting how only when it's become an academic field that sort of we're raising the light on it, you know. I mean, to actually tell somebody who's from these cultures, about compassionate communities is like, as you say, suck eggs, like
Yeah.
it's just
like, what? You need to teach this stuff to Australians? Yeah.
So like, but in the Western culture, we've lost it, unfortunately. Of course, not all places and areas, but in general, because of this individualistic, way of living, I mean, again, there's no community or, extended family living together anymore. It's just the way we live,
Yeah.
and the more we are socially connected internationally, the more we are locally disconnected, which is unfortunate. I mean, with all the social media and everything there
Yes.
is, you'd think that people, are so well connected, but then it didn't stop the increase in depression, anxiety,
No.
suicide rates, all that stuff. So which means we need to see each other. We need to talk to each other because, again, science showed that there is a certain biological, and I'm not in this field, but this is what I hear from my colleagues, there's certain biological reactions that happen physically in your body when you connect with people and talk to them, and hug them, and just share some love and laughter, and friendship. And that's not going to be beaten by anything in terms of IT, or artificial intelligence and all that stuff. So back to the essential, back to nature, people, just be there for each other, learn how to support people. Again, back to my experience with grief and my colleagues. That's one thing that we are hoping to achieve with the compassionate communities is what to say and not to say, because this is all what people want to know, I don't want to be saying the wrong things to create more damage. So if people know exactly, 1, 2, 3, 4, these are the things, try not to say that, and everything else will fall in place. It's simple, but people don't know it. And I didn't know it. I'm not saying I came from, this is why I was attracted. I said we could do it better than this. And I certainly started by teaching myself and learning, and then, hopefully everyone else can. The other thing, Ian, when you told me how do people start compassionate communities, the other important project that we're doing with the local government, Bunbury City Council, is to get a compassionate charter, because it's going to basically glue the whole community together into focusing on being compassionate, whether workplaces, whether schools, whether faith organizations, whether, the aged care sector, sporting organization, art galleries. So in a way, it brings the conversation at a higher level, not just, at the level that we've got it now, if you have a terminal illness, which is very important. And with the preliminary work that we started doing with the community consultations and forums that we are doing in the city of Bunbury, people want to have something tangible. Okay, tell us how we can help. So one of the things that they really understood is the connector program. Yes, we can be volunteers. We can do this thing if we are shown how to do it. So that's wonderful. If we can increase the number of people who, are interested to adopt that kind of volunteering model, because again, it's different to a hospice model or the traditional hospice model, especially when we are now in an era where all research is showing that volunteers rate are dropping. People are not really, and COVID-19 didn't help in this either. So to get people to know that the way they're going to volunteer, it's about spreading more compassion. That is really something that the community is happy about. And there are a lot of compassionate communities. Ottawa is a compassionate city, Bern, Köln, and few of the US, so again, that's something that we need to work on in every, place in Australia.
And Samar, just finally, talking about compassionate communities and hearing the impact they have at that local level, what would your pitch be to government, I guess to state government and federal government that fund our health system? I imagine a compassionate community saves the health system money because of the benefits that you've pointed to. How can state government, how can federal government support a compassionate community? Is it investing more in palliative care services, or is there what can those higher levels of government do?
That is my next topic of thinking about this, how we go forward from here, because with the way we've done it, it's very volunteers, but people need help even when they are volunteers. people need to be trained. That's the other thing, all that death literacy, grief literacy, you need to get more specialists to help the community with this. So this is at the moment where funding is needed in getting more of these specialist people to help the community, to build the capacity of the community. And of course, they need to be paid. Palliative care services definitely need to be more supported to actually deliver the whole holistic aspects of care, not just clinical care, symptom management, which I said again, they're doing this very well. And the latest review of palliative care services we did in Western Australia from a consumer perspective, and people who have used palliative care services gave their feedback, as well as those who didn't. And invariably, those who had palliative care rated all the services at much better quality than the ones who received non-palliative care services to help them. So it's a wonderful field, but we need to be able to broaden the scope of palliative care services to be able to be more involved in family carer support, in bereavement support, in the spiritual existential support, in the psychosocial support. And this is where the community then will understand better what palliative care is about. It's not just an extension of oncology, of some of them think, or it's not really, it doesn't belong, with, only the death part, Yep. So, there is a lot of community awareness. And again, this is where funding needs to be spent.
Samar, really appreciate your time and your wisdom today, and how exciting for our sector, the palliative care sector, the health sector, that this Australia Day Award has come along, and you now have this platform to bang this drum on our behalf, on the community's behalf, and try and drive the change, drive the improvement that we all hope for. We'll all be cheering for you come Australia Day. Good luck. We'll all be cheering you on and wishing you well. And we should also mention that another champion of the sector has also been recognised as part of the Australia Day Awards. Teresa Plain from New South Wales has been announced as the New South Wales Senior of the Year, and is in line to be the Australian Senior of the Year, recognising her decades of service as a palliative care nurse, advocate and volunteer. And we wish Teresa really well as well. Thanks so much for your time today, Samara.
Wonderful, Ian, to have palliative care in the spotlight.
Isn't it?
Wonderful, yeah. And thank
Happy
you.
Australia Day, Samara.
I will feel all the warmth and love on the day as well from all the palliative care community. Thank you.